Hi there, everyone. Me again. Today I'm going to talk about a topic very close to my heart, and I wouldn't be talking about this if it wasn't also part of my experiences and my journey. I'm going to introduce you to the topic of complex post-traumatic stress disorder. I am not diagnosed with this disorder, as it does not exist in the Diagnostic and Statistical Manual of Mental Disorders yet. However, let's just talk about it, and I'll start with the causes. So, first of all, prolonged trauma, where it is impossible to escape abusive conditions. Those include childhood abuse, physical, sexual abuse, and incest, neglect and or abandonment from caretakers who may be physically present but may have themselves a mental illness. It can be caused by being a prisoner of war or living in war-torn territories. Torture, physical or psychological, genocide, extreme poverty, or witnessing violence. The symptoms of complex post-traumatic stress disorder. So trauma is stored in the body in the central nervous system, which connects to the amygdala. And this is also called involuntary amygdala hijacking and can lead to uncontrollable outbursts of anger, prolonged deep sadness, crying, inability to feel hope or peace, fear, and hypervigilance. Trauma in the nervous system is connected to the fight, flight, freeze, and fawn responses, codependency, low self-esteem, flashbacks, triggers, depersonalization, which means that you feel like you are looking at yourself from a distance, derealization, where the world and people look fake to you, dissociative dissociative identity disorder, and then I'm including bipolar mood disorder, although this is not officially recognized as a symptom of C-PTSD, but I've been diagnosed with this about 15 years ago, and it includes symptoms like depression, anxiety, or hypomania, and hypervigilance. And then other symptoms of the disorder is dysfunctional relationships, distrust and isolation, substance use, eating disorders, self-destructive behaviors, including cutting, suicidal ideation or attempts. Treatments involve EMDR, which stands for eye movement desensitization and reprocessing. I have not experienced this kind of treatment, and I'm not sure exactly what it involves. I have, however, been in therapy where the therapist incorporated cognitive behavioral therapy. I've discovered a treatment called emotional freedom technique or tapping. And then psilocybin treatment is recommended by Dr. Gabor Mate. I also use yoga, meditation, and 12-step recovery programs. Then in terms of the prognosis for this disorder, it is lifelong, it is pervasive, affects all areas of life. It is treatment resistant because, and then we get back to the symptoms, failure to trust, isolation, apathy, numbing, which can be deliberate actions to avoid reality. So if you know someone who is diagnosed with complex post-traumatic stress disorder, what you can do is to listen without judgment and not offering advice unless you are asked for it, to be a friend, to have clear boundaries so you don't become overwhelmed by this person's emotions. And then lastly, to accept and love us for the person we are today. I hope that makes sense, and thank you again for your engagement. As always, have a lovely day. Take good care of yourselves. Bye-bye.